let's make me as an example. I took a chance for making my body the way I want, for building myself a dream Natalie, becoming that person I always want to be, and one of the part of it was having a wonderful body, an amazing body. And it's been 3.5 months, and guys, I never regret it. I'm telling you, it was one of the most significant change of me during like last a decade of my life. So yeah, here I am with a new body, with a doctor who gave me that body, and I'm going to be answering questions for you to understand actually how the procedure went and how my recovery actually going.
Yes, good. So send us your questions. We're going to ask a few questions now, and then we'll take questions from the audience. So one thing I want to know is, before the surgery, what was something that you were really worried about? And I want to know if you were, after surgery, you thought that was a valid concern, or that wasn't really a good concern?
So my first thought was, when I woke up after operation, I was like, okay, I woke up and I'm like, okay, how was the procedure went? I want to see my procedure, how it went. And I remember Dr. Jacobson came to me and said, "Good morning, Natalie, how are you feeling? You did great, you did amazing." And I'm like, yes, I did great, yes. And after, I remember when I went home, I went to the mirror and I'm like, I was swallowing a lot, and I was wearing like I was having those tubes and I couldn't see much, but even then, I already felt like I did an amazing job and the results are great. Even being swallowing, I already felt like, yeah.
Good.
Even though I was in a pain for first 3 days, but after it went like very
good. Yeah. And what do you what's your recommendation in terms of if patients have pain after surgery? Should they hold off on the pain medications, or should they take them if they feel like the pain is coming?
So in my case, whenever I felt pain, I took a medication. So I wouldn't hold off on that. I just wanted to sleep. So first 3 days, I practically slept. I don't even remember me eating much. So I felt like an urgent need for rest. And I remember I was drinking, I don't know why, it's just a weird thing. I was drinking pomegranate juice constantly, and I think I drink aloe vera water. So it was first thing what I wanted. After I had the breakfast at that clinic I stayed, actually wonderful facility. And yeah, it went pretty good. I used bathroom with no problems. So only one moment I was like very dizzy and could like walk just a little bit around facility.
Good.
Yeah.
And were you nervous before the surgery?
Well, I think I was a little bit nervous being under anesthesia for 6 hours. It was like a lot in my opinion, but when I woke up, I remember that I woke up clear mind. I didn't have headache, I didn't have any like post-operation anesthesia, and no, my mind was clear, I felt very good, so that fear was not really happening.
Yeah, and I do a thorough screening of the anesthesiologists I work with, because they have the patient's life in their hand, and they are a big part of the team, so that's very important for me, and that's why you did so well, because you had a really good anesthesiologist.
Yeah.
So then after that, how was the recovery the first few weeks? What was the biggest thing about it?
So first few weeks I was wearing the bandage that was pretty tight. It was made in order to remove all the swallowing and all the liquid, because I had to carry tubes with me, which was a little bit uncomfortable, because like I had to empty those tubes. It was a part of the procedure, so I was like on the duty to empty tubes and make sure the liquid coming out. Also, I remember that I had to do the massages. It was painful, because the need of that lymphadrainatic massage was to empty the all lymph, so all liquid will come away in order to remove the tubes faster. And I remember that I was pretty good girl into doing the lymphadrainatic massage because we removed tubes like in 1 month.
Yeah, probably even less. I think
Even less. So it's like
two weeks. I think.
Yeah, so massages are important, and I remember doing them like every second day. So I was so like for 10 days I was so intense on the lymphadrainage massage. So yeah.
Okay. After the surgery, how long did it take you until you felt like, wow, okay, I'm back to my normal?
So I remember I was like, I needed to get refilled for my medicine. I was like, I'm so driving to CVS, and honestly, it was like on the fifth day. I know you told me like at least 10 days, but I was like, I'm gonna make it. And after 5 days after my operation, actually, I start driving, and I succeed. I mean, in my case, it was like perfectly fine. I returned to my college after 6 days of operation. So I was online, doing all college online, but I returned to my regular life online, and I feel pretty confident.
Okay,
Yeah.
good.
5 days after operation.
5 days. That's amazing.
So actually, yeah.
What is one thing that you didn't know about the post-op recovery that afterwards you're like, well, I wish I had known this. I didn't know that.
Oh, I wish I would know that. I think I was pretty much instructed by you, but maybe because I was lucky, so I had all the instructions, all was written, and I was prepared to everything. So in my case, I didn't have the, oh, I wish I knew, because you actually instructed me so well. But probably there are some doubts we should discuss. Maybe there is something people need to know. I don't know. In my case, it was not.
Yeah, because we talked a lot before the
surgery.
surgery.
Yeah, like I had 3 consultations, like I had all preparations. I was prepared for everything, so I was like lucky.
Yeah, good. So now after the surgery, how long did it take you to kind of stabilize in terms of your swelling and start to buy new clothes?
Okay, so the process of changing fachas are very important because your swallowing doesn't disappear itself. Doing an operation, it's only a half work. Other half work require a patient, and it relies only on your ability to follow the steps that are given by doctor, which one of them is major facha. So in my case, I had to change facha every 2 weeks. So since my first facha, it's been facha number 4 or 5. So facha given to release the tension and remove swallowing. Yes. So every time it has to be tighter and tighter and tighter. So now you see me. Let me even step down. So
wow.
You guys, you see me.
It looks amazing.
Yeah.
It looks so small.
So it's a facha number 5, I think. And as much as swallowing could go, it's been like 3.5 months. So those are result, and it's not final yet. So we're still on the road of getting my perfect body. So it's gonna be another facha probably. Usually patients change fachas around 6-7 during the recovery process. So it helps to shape the body and keep it actually that way. So your muscles actually adjust to, like, so you don't put it back, So fachas are very important, and I'm grateful I was instructed, and I'm very smart on that, and I keep a track on it. So yeah.
Good. Yes. And I tell patients, it's actually good that you have to change fachas because you actually see yourself shrinking, and you keep getting smaller, and you actually see the results. So that's actually a good thing that patients actually like. So how do you feel like your lifestyle has changed after the surgery?
Well, I feel like my life changed drastically because I get a lot of attention. I mean, I feel like I became the person who actually owns the space whenever I enter. facility. Whoever there, people turn their heads and they look at me. I get compliments like, "Oh my God, you have wonderful figure." People who know me from the show, they say, "Natalie, your figure looks amazing and you look fabulous." So, I mean, I get a lot of compliments on my looks. Also, I feel like my self-esteem raise up. Like, I feel like 10 now. Before I used to feel like 6 maybe. So, and what I learned, that self-esteem actually relies a lot how you present yourself, how you talk, how you... like the way you feel in general. Something shift, energy shift in me from woman who lost weight and was not sure how she looks, and when I was looking at the mirror before, I was like, oh, I'm not confident, I don't know if I can be confident in this dress, I don't know if I can wear the swimming suit, I don't really feel that beautiful girl. So energy shift from that image to a person who actually say, well, I look perfect in that beautiful dress, I look perfect in that swimming suit, and I think like I just own it, and time is on my side. I feel like it just everything lined up perfectly for me, and body, my look is a huge part of this change.
Good. I'm really happy for you. I can definitely see the energy change in you and your self-confidence, your self-esteem. And no, it's definitely true. What would you tell the audience or people who are on the fence about getting the surgery?
So, I mean, there are always concerns and there are always what if thoughts, because it's our nature. We belong to species who actually have imagination, and we always like have a fear. It's a survival mood. But I also think that fear sometimes prevents us from getting best results, and people who really try to accomplish their dreams and have their goals, they have to consider life-changing procedures, because looks are very important. And fortunately or unfortunately, whatever we say, we always get attracted to visual content. We always get attracted to people who look good, who are sporty. We always want to know what actually they do in order to become that best version of themselves. What are the tips they can actually give us in order to pursue that image, in order to become this perfect, beautiful version. And I think like I did the best choice. I found you, and I'm so grateful that first of all, I trusted you, and it's a huge part of choosing the doctor, trust. When I saw your results, when I searched for the clinic, I remember I did research for several months, and I remember my first consultation was I was hesitant. I was like, I don't know, like I have so much fears, but the answers you gave me and how you hold the conversation, and when I saw the results of patient, I felt like I'm doing right choices and I'm trusting you, and I was like, I choose a doctor, so I'm ready for the change journey, and I have not regret even a single bit.
That's awesome.
Since I became on the journey of my beautiful body, and I'm so grateful, and I can recommend you with my open heart, and I feel like you can change the life of many women, and I'm excited for that journey as well.
Thank you. You know, I do want to thank you for being open about your plastic surgery, because your fans are actually lucky that you're so open. In the past, we know there are a lot of celebrities who get surgery, but they don't say.
It's
they
an
just
error. And they're like, oh, it's my natural look. I did nothing. I did nothing to my body. Yeah, and people like to hide, and I don't think it's a good.
No, it's if nowadays people are being a little bit more open about it. Yeah, but the problem is people out there, when they see someone just changed and then they're not saying they got surgery. Yeah, exactly. They feel bad because they do the diet and they do all this and they don't change, and they feel
they buy protein and they like. They buy protein and they're like, yeah, but I follow the tips. I bought protein. I put my face into the ice every morning. You know, like I do those massages, but it doesn't help. it will not help because skin doesn't shrink. You have to, when you lose weight, you have to understand skin will not be the same. And this is the truth. You eat it or not, this is the truth. And I just honestly revealing it, and hopefully you will make those changes in your life like I did.
Good. I remember also you stayed at Alma Aftercare after your surgery, that facility.
Yeah.
So what do you think about staying at an aftercare?
So even though I actually live in California and it's only like few hours from the hospital, but I decided to trust because like post-operation process could be dangerous because we don't know how we gonna feel, and being able to have doctor to see you anytime after 4 days at least, it's very important. So I think I was lucky because I chose the Alma Care. First of all, I had a nurse who actually was 24/7 with me. I had a private chef who cooked for me, even though I didn't eat first day, but second day I had a breakfast which was delicious. Also I had visitors, which also was a part of recovery, so I wasn't feeling alone. I was treated well, I was having princess treatment, and I think like it's important, especially if you come from another state. Just hotel is not enough. You better be sure, make a good decision for yourself, which was actually Alma Aftercare. And I would recommend patients definitely to stay on a loop of your presence and being able to get taken care of a private chef and nurse. And Alma Aftercare have nurses, trained nurses, who gives you like good treatment, medicine, everything. You're protected, like, and after 4 days you just fly home. And especially for people like who want to have their privacy, don't want to be seen on public, and like you just don't want to be seen. And the facility guarantees your privacy, your peace, and your ability to recover. And I think it went pretty well.
Yeah, and then also there are people who perhaps don't have someone at home that can take care of them, or the people around them aren't so comfortable taking care of them. I think that this is a good alternative for them.
Yeah.
All right, so let's see if there are any questions from the audience.
So in my case, I actually took a credit. There are many credit lines that could be offering. And I applied for credit and I took it. So I was lucky with doctor because I was like, guys, will you be able to accept credit line from me? And we did. So
fortunately,
you're lucky because this doctor accepts credits, which is great, and you can afford separation.
We have multiple companies that we work with: Cherry, Patient-Fi, Alpheon Care Credit, and the patients have had a lot of good experiences with Cherry and Patient-Fi, and you can basically apply to them. They do a soft credit check, and they have interest-free options, and a lot of patients have really been able to take advantage of it because if they don't have the money now, they can just pay monthly payments, and they work with you to put you on different payment plans, and that enables a lot of people. Just like how when you're buying a car or your house, this is an investment in your body. You only get one. You can buy cars every year, but not your body.
Agree.
So.
Some people are also asking about how do you manage like scar treatment? What did you put on your scars? How did you manage?
So, lucky me, guys. About scars, we live in an era of technologies. Now I'm having like before the 2 months, I was putting an oil. I forgot its name for the oatmeal and oil. Now I'm putting the Isolant, like a special scar treatment thing.
The silicone sheets.
Yes, and after a year, I'm gonna go to laser treatments and I'm gonna remove all the scars because, like, people who say, Natalie, you're gonna have scars. Guys, I used to have a lot of tattoos. If you remember, some of my following maybe remember, I used to have a tattoo on my wrist. So I did laser
wow.
treatments and I removed all the tattoos. So now we have a lot of procedures that actually removes the first layer of a scar
That's true.
and 6 7 procedures and you just don't have a scar at all. And I already tested on wrist and it's more sensitive, even more sensitive than my stomach, and it's nothing. So about scars, don't you worry, because there are treatments that are already offered on the market, and you will not have it in 1.5 years. You will
Yeah.
not have it.
Yeah, and the scars for tummy tuck tend to be very thin,
Yeah.
and like
It's
Natalie
like
is
very
doing,
low.
and very low. You can hide it in your
So I
bikini.
had it in my bikini. Yeah.
Good, yeah. And also, once it's the appropriate time after surgery, I'll have you put silicone sheets over them
Yeah,
so
I'm
that they
having-
stay thin. And then after about a year or so, you can do either laser treatments or you can tattoo the scars. So there are medical tattoos that can be done in the scars to blend the scar to the skin. You can talk to my office. We're in the process of offering it in our office. So you can talk to my consultant, Heather, and she can help you with that. And a lot of patients like it because it just blends in with their skin.
So there are many options.
Yeah. What
We
else?
see.
Everybody wants to know about the faja. What fajas do you recommend? What stages did you go from? How'd you start out? What'd you end at?
Yeah. So my first faja was like
The one
a
I gave you.
yeah.
So we always give you the first
Yeah.
faja that comes with the surgery. So the day after surgery, I see you, I measure you, and I give you the first faja because I'm very particular about that first one. Your skin is still fresh from the trauma, and it needs to have a delicate faja. So that one I give you, and then after a few days, then you progress to smaller ones, and then after that, I guide you through what brands to get, but also she probably has some recommendations.
I forgot her name. How is the woman name? The
Lydia.
Lydia.
Yeah. So yeah, that wonderful lady Lydia. She measured me, and I usually drive to her shop, and she offers a custom-made fajas. Why custom-made fajas are important? Because some people think, oh, I'm gonna save money on faja. I just buy it from Amazon, or I just buy any fajas that are like cheap. And that is a huge mistake because fajas, it's a process of your operation, and the quality of it is very important because you wear it 24/7. And I was really working hard on choosing right fajas for me, so it took my time. I went to the shop. Lydia would measure me. It would took me around 1.5 hours to be able to choose right one. So it was not like Amazon order done. No, you have to like consider making even your own faja because each post-operation bodies like they react different, and for some people it's like less losing the liquid, for some people faster, like in my case. And custom made fajas from Lydia actually made it for me.
Yeah, and I keep a close eye on my patients. I have them send their progress photos every few days, every week or so, and I tell them, well, now it's time to go to the next faja. Sometimes patients don't want to be so uncomfortable, and they don't want the faja to be tight. But I'm kind of like that tough coach. I'm like tighter.
You can do it. You can do it.
Yeah.
I was like, no, Natalie, you have to like put it on this like level. I'm like, it was so painful at the beginning, but next day I just felt like
So you quickly shrink with the fajas, and that's one of the things that it's the culture of my office and my practice, and my coordinator knows, and my office knows that the surgery does not end at the end of the operation. The process continues, and we hold your hand until you're fully recovered. And that's one of the things that I pride myself in, and I do not want you to feel like you can't get in touch with us or we're not guiding you through the post-op process.
Thank you.
Shout out to Heather for talking to all the patients and
Heather.
yes.
People also want to know, like, what was sleeping like what was that experience like, right?
Mm-hmm.
Yeah.
So first week I had a lot of pain. But after, first of all, you get used to wearing faja. It was not like something life-changing. I felt like I slept, like I didn't have like troubles with sleeping. Also, every time when you put a new faja, it has to be like tighter. So your body needs to adjust. So in my case, I remember like most noticeable discomfort. It's like every first night after new faja. So once I put a new faja, it's tighter. It's a new faja. I put it in the fridge before, so it's a rule like you put it in the fridge, so it's like doesn't tickle you, doesn't scratch or anything. After you take it out and you put it on, so first night you a little bit feel it. Second, in the morning you already like, oh, that's like it was, that's it. So in my case it was like pretty normal.
And also, as you know, I always have patients sleep in a beach chair position, kind of bent for a couple of weeks. How was that?
Yeah. So for the first couple of weeks, I remember why you told me that, because I was having tubes with blood, and so I was
we
like,
pulled the skin really tight.
yeah, and that was really tight. So basically, I think I had like pillows behind me, and my position was a little bit like half sitting, I would say. But honestly, I wouldn't like, I would just switched off. I wouldn't like even thinking about it, because like I was so, my body needed recovery so much. So it just like was like, and those tubes, what I was worried, not about how I sleep, about those tubes not to, not to put my body on the tube so that blood like wouldn't, so I would put like basically on the corners of the bed, because like you had a long like a tube, so they were really far from me, so it was like moving a little bit, but my concern was mostly about tubes and keep an eye on it.
Okay.
Yeah,
and those tubes are pretty hardy, so I think you were a little bit on the more cautious side, but I've had patients who just throw them around and then they're still fine.
Oh, they were fine. Yeah.
Nothing happens to them.
Someone asked, is inner thigh lipo common? So I know you did your tummy tuck with some lipo, right? Like, is that a common procedure that you see in conjunction with the
But I also had muscles sewed.
Yeah.
My muscles was torn. This was also like...
If somebody's interested in that, do they go together? Are they separately done?
Yeah, so I've had patients who got inner thigh lipo at the same time as tummy tuck. That can be done. I think that's a good combo. That's pretty doable. I think Natalie was referring to another part of the procedure, sewing the muscles. A lot of times, if you gain weight, your abdominal muscles kind of stretch. Sometimes some people just naturally, some people just naturally have more stretched, separated muscles. Or if you've had some pregnancies, that stretches your muscles as well. So in your case, you had gained weight, and it stretched, and probably you may also have it naturally. So I always sew your muscles together if I'm able to, and bring them together, because that helps make the stomach flatter and also
make a shape.
Yes.
Glass shape. Now I'm like having a glass shape, because basically here I lost like I don't know, like this.
This much, yeah.
Yeah, I lost like a lot here, so it given me the shape. A glass shape.
Hourglass,
desirable. Glass
what
shape.
else?
That's a really good question. How long does the swelling last?
It's still actually going. Now what you see, I'm wearing a corset. I'm a little bit bigger than, like, if you remove the corset, I'm a little bit bigger. But why? One of the reasons, because I still have a little bit numb here. Like, numb would go really slowly. Like, at first it was like whole the stomach area numb. After slowly I could feel those muscles. After upper muscles, I feel like lower muscles, but medium area is still swollen a little bit, and that is the reason we were in Faja, because the liquid is still like coming with my urine slowly. So it will take probably half of the year.
Yeah, so that's what I tell patients. Pretty much
It's
after
still
about
going.
5-6 months, all of your swelling will be gone,
Yeah.
pretty much. But a lot of it
Yeah.
will go away after the first month and a
You have
half
to
or
be
so.
ready.
But until 6 months, you still see yourself shrinking.
So 3 more months, we're gonna see more results, and like I would say, like I feel and sense 60% of my stomach area, but still there are areas I do not like. I feel like a little bit numb, and they're like a little bit like tight. I would say, yeah.
Yeah, and you're gonna have some numbness in these areas because the nerves are cut and stretched, and usually with time, that sensation comes back.
Yeah.
And
What
then
else?
somebody else, a good question, how many hours is the surgery? Can we talk
6.
about that a little bit?
Yeah, so like in your case, it was around 6 hours. So it varies depending on if you're going to need liposuction or not, if you're going to need muscle repair or not. So it's around 4 to 6 hours or so standard. Obviously, I can do it in 3 hours, but that would be super quick, and it's not going to be a good job. I take a lot of time in doing meticulous liposuction, using Vaser to melt the fat so that I can get it more atraumatically and also get more fat and get a smoother results. I spend a lot of time on closing the incision. I close all my incisions, so that's why they come out so thin. And so I'm very meticulous. That's why I wouldn't want to do it in 3 hours.
Yeah, I feel like, yeah, it's like life-changing procedure. It's better like to take time on it because it's like an artwork.
Yeah.
I feel like an artwork.
Yeah. What else?
Somebody said, did she have her ribs removed? Nope, that's just...
No, I did not. That's for sure. No.
No, she hasn't.
Yeah.
I know that's a little bit popular these days. Well, I still have not done it just because usually when something is new, I'd like to wait a little bit just to see what are the negative things that come out, because I've seen so many of procedures and medications and different things that they come out, they're revolutionary, and then 2 years later they're like, oops, we didn't tell you about this, we're pulling it off market. So safety is my number one priority. That's why I'm giving it time.
Yeah, and I wasn't even considering, like it was not even an option for me because I wouldn't even think.
Yeah.
Ribs, like it's, yeah.
How about, is lymphatic massage mandatory?
So if you want to have good results, yes. Obviously, I'm not going to tell you I'm not going to do your surgery if you don't get lymphatic massage. Of course, I would do your surgery. But if you want to have good results, it's great. And also, a lot of patients say when they do it, they feel so much better. I've had patients 9 months after, they say, I know you only told me I only need 10, but I've been going to the lymphatic masseuse because it just makes me feel so much better. But generally, 10 is mandatory if you want to have good results.
Yeah.
And then somebody asked, we have a lot of questions about pricing.
So for pricing, please call our office, 424-465-3800. That's 424-465-3800. My consultant, Heather, is really helpful. She will take forever to talk to you. She will talk a lot, and she'll tell you everything, and she'll talk to you about pricing, the ranges, and she's super helpful. If I ever want to get surgery, she'll be my consultant.
And mine. And mine. Yeah.
We just had some people join the chat. So Natalie, they asked if you could do a 360 to stand up and show.
Yeah.
Ooh.
Okay, guys. Now, 3.5 months post-operation. Okay, this is my body now.
Wow. Wow, that's amazing.
As
Yeah,
you
that's a
see.
huge change.
Yeah.
A lot of time, we have a question that says, is it dangerous to combine lipo with the tummy tuck?
That's a very good question. So many years ago, we didn't have the techniques or we weren't following the techniques. And so a lot of the older generation of surgeons, they don't combine it because they say, well, blood supply and all that stuff. But the way that the new generation of surgeons, including myself, does it, basically we are able to liposuction and still maintain good blood flow to the skin, because that's the main concern when you combine lipo and tummy tuck. And that's what makes it not dangerous in terms of the blood flow. In terms of overall complications, it's still safe. There are a lot of research studies that have shown that if you do it the right way, it is safe and you actually get much better results.
And then somebody asked, what's the BMI to get this surgery done?
That's a very good question. So with BMI, BMI is actually a very old measure. It was invented in the 1960s, and nowadays it's not. They've realized that it doesn't always correlate with the complications. So I look at the person as a whole, where their fat is, how their body is shaped. But generally speaking, we say your BMI has to be below 35 or below to be able to do it safely. And obviously, the lower it is, the nicer your results are going to be. But usually once your BMI is above 35, we tell you need to lose at least some weight so you get below that.
And is it dangerous to combine a tummy tuck with liposuction, or can you do them together?
No, it's not. It's not dangerous. You can do it at the same time, but it should be a surgeon that does them all the time so that they know what they're doing, because it's a little bit of a different technique.
We have a lot of people interested in the aftercare services, so people are wondering, like, did they pick you up? Did they drop you off? Or like,
Yeah,
what was it like?
I had one of the car picking me after the surgery, so it includes the services of the Arma clinic, and I think like it was best decision of mine to actually take the service, because at least what you want, move through traffic, like home or to hotel, especially if you're not from here, it's least what you need. You need minimum, first of all, the clinic is like 20 minutes from here, very close, and nurses waiting for you. Whatever food you want is gonna be cooked. So, because some people have allergies, some people are diabetes, some people they have some restriction, food restriction. There are heart problem, anything like whatever problem people deal with, they need special diet. And I think like it's very important to be treated right away, right? Like
Yes.
so yeah. So
Yeah,
I was offered food I wanted.
Good,
and
yeah.
drinks I wanted, and I was like, I just had it.
Yeah, and she recovered well there. So yes, they do pick you up from the surgery, and then the next day they can bring you to the office when I want to see you for your post-op appointment. And also they have the nurses. They give you your medication when it's time for it, and they have a direct line to me. So if there's any concern, any questions, they call me right away, and I can easily go there and see you in case there's any issues.
And people want to know, how long have you been doing this?
So I've been doing plastic surgery for I think around 8-9 years-ish or so.
And people are also asking, you know that vibrating pad, we get asked that question a lot. Does that help aid in the recovery to get the lymphatic system going during your healing process? Do you recommend that, right?
Not in the beginning. Usually if your lymphatic massage therapist starts suggesting different modalities throughout the way, and I always tell patients, well, ask us, because different people heal differently at a different rate. So they'll ask us throughout the way, can I start this kind of massage? Can I start this kind of machine? And they'll let us know. But usually in the beginning, I don't want you to be on that plate.
And then do the silicone strips stay on for a few days at a time when you're ready for them?
Yes, they do. You can just put them on and keep them on for up to a week. and you can shower with them. You can even take him off and then shower and put him back on.
Yeah, which I do. I do not shower with them. I usually take it off so I clean it because I still use that gel, washing gel, sterilizing one. I clean my body. I put the oatmeal, and after I put the strips around the scar and in a ball. I love my belly button now, belly button area. So I cut the small strip and put it around belly button area, which is important. And that's it.
Good. Well, I think we're out of time. Thank you so much for joining us. This has been wonderful. Thank you, Natalie, for sharing your experience with the fans and with everyone out there. I know people are so appreciative that you're open and honest about it, and you can tell them about the whole process. And send us any questions you may have. And if you have any questions, comments, if you need guidance, again, for pricing, please call our office so Heather can talk to you depending on the procedures you want, the combinations, and all. There are many variables. So thank you for joining us, and stay tuned. We'll have more coming.
Bye.